Hi, I am Dr. Raouef Ahmed Bichoo. I'm a breast oncologist and breast surgeon. Welcome to Breast Health India's video on Oncotype Dx. As we know, breast cancer is the most common cancer in women. They are usually offered multiple treatment modalities, which include surgery, chemotherapy, radiotherapy, and other forms of treatment. The most toxic of all treatments is chemotherapy. A while ago, all ladies were given chemotherapy irrespective of their molecular type. However, we do have developed certain tests which helps us to determine if they actually need chemotherapy. One of the tests is something what we call as Oncotype Dx. It looks at certain genes in the tumor cells and determines a score on the basis of how much of those genes are expressed. More the score, more is the risk of the disease coming back and more is the benefit of chemotherapy. This test is usually performed in a lab based in America. We can send tissue from the core biopsy or from excision biopsies, and it usually takes 2 weeks for the results to come back. Now, the report that comes back, it gives us the recurrence score, it gives us the risk of recurrence if the lady does not have chemotherapy at 9 years, and it also gives us the chemotherapy benefit. Now, all of these things will help us determine if a lady benefits from chemotherapy or not. Oncotype DX is not performed in all types of breast cancers. It's performed in cancers which are estrogen receptor positive and HER2 negative cancers. According to NCCN guidelines, all cancers which are estrogen receptor positive, HER2 negative, whether they are node negative or have 1 to 3 nodes positive, they are offered Oncotype DX if they are more than 0.5 centimeter in size. However, according to NICE guidelines, it's only approved for use in node negative patients which have an indeterminate risk of recurrence determined from clinicopathological factors. Depending on which guidelines we follow, we offer them to help us guide treatment decisions with regards to chemotherapy. It is a very costly test. It usually costs around 3 lakh rupees as of now in 2021. As time goes by, the cost might be reduced. The Oncotype DX results have got two benefits. Benefit one, it has got a prognostic value. It tells us how the lady is going to behave over the next 10 years. What are the chances of the disease recurring in this lady? The second benefit is it tells us the chemotherapy benefit, how much benefit the lady gets from chemotherapy. The score ranges from 0 to 100. Now we categorize ladies into low risk, intermediate risk, and high risk. Scores from 0 to 10 are usually considered as low risk. Scores from 11 to 25 are considered as intermediate risk, and scores more than 26 they are considered as high risk. Inevitably, ladies who are low risk, they do not benefit from chemotherapy. They are well off only with endocrine therapy. However, ladies who are high score, more than 26, they do benefit from chemotherapy. Now, in the intermediate group, the trial called as TAILOR-X trial, in the postmenopausal ladies, they found that in this intermediate group, which is 11 to 25, they do not. They can safely forego chemotherapy. But in premenopausal women, there was a slight chemotherapy benefit. And this is usually discussed with the ladies whether they will want to have chemotherapy or not, because the trial was not sure if the benefit was because of chemotherapy or it was because of ovarian suppression. In the node positive women, we categorize them from 0 to 25 and 25 and above. But anyone who is more than 26 and above, they are offered chemotherapy. But in ladies, while the recurrence score is less than 25, there was a trial called as RX Wonder trial, which looked at if they will benefit from chemotherapy. What they again found was in ladies who are postmenopausal, node positive, less than 25 score, they do not benefit from chemotherapy. However, in premenopausal ladies, again, the benefit was they couldn't exclude it. So there is a chance that they do benefit, and it's again a discussion with the ladies. I hope you find this video useful. If you want to know further about Oncotype DX and whether it applies in your case, do speak to your oncologist. They will be able to help you understand it and applicability in your case. There are other molecular tests available in the market as well, namely MammaPrint, PAM50, and EndoPredict. They vary according to the number of genes that they look, but they also provide the same information as the Oncotype Dx. Oncotype Dx is the most commonly available and most commonly used gene assay in breast cancer. Thank you for watching.